Get started. First of all, I want to thank you all for coming this morning. You all look beautiful, smiley faces on a nice Thursday, beautiful morning in the beautiful coast of Franklin County. Right now, I'd like to introduce Jennifer Harper. She's the manager of the Apalachicola National Extra-Marine Reserve Research. Jennifer?
Good morning. I'm so pleased to welcome Dr. Armstrong and all of you to the Reserve this morning. I was asked just to say a few words about the Reserve. I think most of you have probably been here before and seen our Nature Center, and I hope have had some experience on our boardwalks that we're going to be walking on today. We just finished our last loop in June, and it's about a 1/3 mile walk in total. Let me say a few words about the Reserve. We're one of 28 reserves around the country. The purpose of the research reserves are to bring concentrated science and research to a specific estuarine area for the benefit of learning more about what we can do to better manage our resources in this area and protect it. So we have several programs here that are working together to do this, bring science to management. And in Florida, we have 3 research reserves. There's one at the Guantanamo Matanzas over near St. Augustine and one near Rookery. So just for your benefit, if you, Dr. Armstrong, if you want to go visit our other research reserves. And we mostly manage open water, so the estuarine system, but we also have uplands. We manage Little St. George Island and some of the marsh areas and several other little smaller areas on St. George Island, and I would ask that you guys look into the areas that we manage and look for recreational opportunities to get out and enjoy sandy beaches and some of the swamp areas and the open water, of course. So thank you all for coming, and look forward to going on the wellness walk with you all.
Well, thank you, Jenna. And I also like to acknowledge Brenda Ash, City Commissioner of Apalachicola. We have our couple of our local partners here, Kathy Rutherford with Gulf Coast Risk Source. We have our Conservation Corps of young people here. We thank you for coming out, seeing us. We have Joe and Janet Taylor, Franklin Promise Coalition. Forgotten Coast TV Media, Ross Rostad, he's our media partner. We also have David Elderstein with Apalachicola Times coming. We also have our fitness challenge participants. If you're a fitness challenge participant, raise your hand, and we want to just give you a hand clap. I am one too, but I haven't won yet, but I'm making my way through it. It's not a sprint, it's a marathon, so I'll win at the end. And we also have with us 2 other people. We have Mary Hale Sacred Heart, one of our medical partners in the audience, as well as the president of our CHIP, Community Health Improvement Partners, Dr. Lois Catlin. Thank you for being with us as well. Well, it gives me great pleasure on behalf of Marshall Lindeman, the administrator of Gulf and Franklin counties, to introduce Dr. John Armstrong. John H. Armstrong, medical doctor and fellow in the American College of Surgeons, was appointed by Governor Rick Scott as Surgeon General and Secretary of Health for the state of Florida on April 27, 2012. A graduate of Princeton University, the University of Virginia School of Medicine, and the U.S. Army Command and General Staff College, Dr. Armstrong believes that education and training are drivers for change. He came to the Florida Department of Health, having previously served as the Chief Medical Officer of the USF Health Center for Advanced Medical Learning and Simulation in Tampa, where he worked to bring healthcare professionals together through hands-on team training. In health policy, he has served as a national leader for performance improvement, older driver safety, and disaster readiness. Dr. Armstrong advocates for healthy choices by Florida's children, adults, and families. He's an Eagle Scout, enjoys pool time with his family, which is very great. I like that, family man. And is an avid jogger, having completed 2 marathons and a number of health marathons to date. As a public servant, Dr. Armstrong is driving innovation, collaboration, accountability, responsiveness, and excellence for the health of all people in Florida. Please join me in welcoming Dr. Armstrong to our welcome beautiful coast of Franklin County.
Well, David, thank you for that wonderful introduction. Jenna, thanks to you and your team for hosting us here. And good morning, Franklin County. Yeah. I'm thrilled to be here as part of our coastal tour, Health in All Places. And what we have launched this week is the first segment of our tour, in the Panhandle, of course. And we're going all the way from Escambia to Taylor County, and along the way, putting a spotlight on all the great healthy choices that people can make in our wonderful counties and communities along the Gulf Coast. And so, of course, Franklin County is all in. This is an ideal place to have an event that gets people thinking about healthy choices. And I work every day with over 15,000 public health professionals across our great state to protect, promote, and improve the health of everybody in Florida. Everybody means people who live here and our visitors, through some statewide, county, and community efforts. The point is that we do this together. And as I look out at this audience and see the extraordinary participation in today's event, I am confident that Franklin County will continue to make progress when it comes to elevating health for everyone. And I think that's worth a round of applause for all of you. Health in All Places really focuses on choice. We're blessed to live in a state where healthy choices are all around us. And I will admit, we live in environments that can make unhealthy choices too easy. We do. But the reality is, those seemingly unhealthy choices should be overwhelmed by the bounty of healthy options. We seek to encourage Florida's children, adults, and families to make those healthy choices day in and day out. Because health ultimately is in those small choices of what we decide to eat and how we are active in life. Thinking broadly about threats to our state, the top threat that we face is weight. It's the challenge of weight. And it's not only a problem for Florida, it's a problem across the United States. And it's a problem that's really emerged over 3 decades. It's a modern issue. In some respects, it has come as a cost of broader economic success. But we know that we cannot sustain continuing weight gain. Listen to the statistics. 36% of Florida adults are at healthy weight. 1/4 are obese, and the rest are overweight. And we're doing better than the rest of the United States. Something has to change. But think about this. On our current path, 6 out of 10 babies born today could be obese or overweight before graduating from high school. That's not a future that we want for anybody in this room. That's not a future that we want for our children. We know that those facing weight challenge, they live shorter lives. And they don't have the quality that they want. We also know that many preventable chronic diseases emerge, which are very, very expensive to manage. And we know that if we continue to expand, it's going to affect the economic vitality of our communities, our counties, and our state. And the good news is that your Florida Department of Health, in broad partnerships everywhere in the state, is addressing this issue head on with Healthiest Weight Florida. We're working through these partnerships that are so visible in this room. Partnerships with other state agencies, local governments, businesses, schools, faith-based groups, civic organizations, any group or any individual committed to helping Florida's children, adults, and families make more informed choices about what they eat and how they are active in life. And the truth is, as we succeed with this initiative, we will succeed across a whole host of other health threats that really are connected to this notion of healthy weight. Now, we started this over 2 years ago, and there were some voices that said, it can't be done. To those voices, here's my message. In just over 2 years, we've gone from being a top 20 to a top 15 healthiest weight state. Remarkable. And that's worth some applause. We have seen reductions among disadvantaged children in our WIC program of 7% in obesity. 7% in just over 2 years? Nobody talks about it that way, but that's the way we roll in Florida. And among behaviors that we know lead to healthy weight, with our high school students, we have seen measurable reductions in sugary beverage consumption, screen time, watching TV, and increases in physical activity. So all of those will lead to healthier young adults, healthier workforce, healthier parents, and healthier communities. So we are making progress, and the reason we're making progress is that we are doing it together. So here we are at the Apalachicola National Estuarine Research Reserve to talk about health in this place and healthy choices that we can make. I'm excited about our wellness walk that we will do along the boardwalk here and what we'll get out of that wellness walk. Obviously, we'll get more steps. I'm a step counter. Any step counters in the audience? I'm a big step counter, 15,000 steps a day. My team will tell you, for me, it's a religion. I get there every single day. And did I ever have a wonderful walk this morning in Apalachicola, by the way? I mean, absolutely glorious. I'm going to call it Lafayette Park. Am I saying it right? Okay. I found Lafayette Park, went out on the pier there. I mean, wow. I mean, this is a magical place. Really, really a magical place. And that was just a walk about, a run about, a jog about. It was right in front of me. I'd made the choice. I took advantage. Well, here, same sort of thing. Only in this case, we're going to be immersed in nature. And that really is part of our Health in All Places tour, is think about your various settings and things that you can learn as you're walking. Walking is great. Being outside and active is great. But there are other benefits that come with it as well. And when you immerse yourself in this wonderful natural setting, it kind of clears the mind of the fuzziness and fog and clutter that can build up with modern life. Makes you appreciate priorities, the important things. Great opportunity to get out with the family. That's health. And the other thing that I believe that this reserve gets is the importance of education about our environments, about our ecosystem, and the central role that people play in keeping our ecosystems vibrant now and for future generations. And keeping our ecosystems vibrant isn't just about having great places to take a walk. You all know very well in Franklin County how important Apalachicola Bay is for the economic vitality and prosperity of this community. And you know all too well what happens when something gets out of balance and what that means for people who live here and what that can do to influence healthy choices. So I am thrilled about putting a spotlight here on the importance of getting out into nature, getting your steps in for physical activity as something you do day in and day out, about the importance of walking in nature to clear your mind, and the importance of reflecting on how important proper stewardship is, and that's stewardship by people, how important proper stewardship is of our very precious ecosystem. What I'd like to do before we head on our walk is to acknowledge some great leaders in this community who are helping us work together to keep health moving forward. You know, we're fortunate in your Department of Health to have a unified Department of Health across the state. What I mean by that is we have a state health office in Tallahassee that supports where public health really happens, which is in our county health offices. And we have great leaders in communities that help catalyze the conversations and the actions for health. So I would ask that David Walker come forward so that I can present him with our certificate of appreciation for everything that he is doing, along with our team in Franklin County.
Don't look too happy now.
Well, let me just get a haircut for the Franklin County team.
And I know how much Marsha Lindemann wanted to be here today, and I can assure you that she has made the right choice to make sure that everything is good in her life, and so we'll make sure that she gets this certificate at a later time. So, David, please convey my thanks to her. And then I'm going to ask that we have leaders for health in this community come forward, and that, of course, really starts with local governments. So I'm going to ask Commissioner Brenda Ash to come forward, and I'm going to ask David Walker to come forward. And I've heard the names of other leaders for health in this community. I want you all to come forward, and the reason is that I'm going to present to you all, combined, this limited edition Health in All Places plaque. This not only symbolizes the reality that we were here in Health in All Places, but it really captures the spirit of collaboration that I see alive on every face in this room and every place that I have gone in Franklin County. That gives me confidence that health truly is here in Franklin County, and you are going to continue to succeed.